Fungi are a diverse group of organisms that include yeasts, molds, and mushrooms. They are unique because their cell walls are made of chitin, a tough material that sets them apart from other microorganisms. Fungi reproduce through spores, which can spread easily through air, water, or direct contact. Fungal infections often occur on the surface of the skin, but can also affect deeper tissues. Treatments vary depending on the severity of the infection. Superficial infections are commonly treated with topical creams, while more severe cases may require oral or IV antifungal medications. The best way to prevent fungal infections is to maintain a clean and dry environment. Avoid sharing personal items like towels, and always wear protective footwear in public showers or damp areas. Choose breathable clothing, especially during exercise, to prevent moisture from building up against the skin. Since fungi thrive in warm, moist environments, controlling these factors is key to reducing the risk of infection. A parasite is an organism that lives off another organism, often at its host's expense. In other words, parasites survive by relying on you for nutrients or shelter. Examples of parasites include ticks, lice, scabies, tapeworms, and mosquitoes, to name a few. Treatment for parasitic infections depends on the type of parasite. Parasites like ticks, lice, and scabies remain on the surface of the skin and can typically be treated with topical creams or lotions. Internal parasites, on the other hand, require treatment with specialized anti-parasitic medications to effectively eliminate the infection. Algae are aquatic plants that include species like seaweed. While algae-related diseases in humans are less common, it's important to avoid contact with blue-green algae, as it can produce toxins that may cause severe symptoms, including paralysis or even death. If algae comes into contact with your skin, wash the area thoroughly with soap and water to remove any residue. For internal exposure, it's crucial to seek immediate medical attention by contacting poison control or visiting the emergency room, as treatment will depend on the specific type of algae and the toxins involved. How do we prevent microorganisms from growing in the first place? Here are 3 definitions of how to eliminate microorganisms. Sanitization. Reduce the number of microorganisms by cleaning surfaces with soap and water or chemicals that you spray on surfaces, disinfecting. Kills germs, again usually with the use of powerful chemical agents. Sterilization. This is the most effective method, often using a combination of techniques to kill off all, or as close to 100% as you can get. This may include cleaning, chemicals, and the use of heat or radiation to help kill pathogens.